A national motorcycle racing champion will soon be able to resume competition after undergoing the first leg lengthening surgery of its kind in Canada at Chinook Regional Hospital. Last summer, Dr. Carrie Coleus became the first orthopedic surgeon in the country to perform a leg lengthening surgery using a mechanical, remote-controlled device called the Precise Nail.
Royce had a shin bone, a tibia fracture back when he was 14, and we think that he had an unrecognized growth arrest at the knee because he ended up with a 4-centimeter leg length difference at skeletal maturity, so by the time he was about 16. So he's walking around with the shoe lift, and we decided this was a good device for him because number one, he's young, has a potential to make good bone when the bone is divided. We lengthen it and bone forms. He doesn't smoke, and he's highly motivated to do his rehabilitation.
I'm a professional road racer, so basically what that is I race street bikes on paved road courses, so it's left and right hand turns, and you're dragging your knees in the corner. You'll reach anywhere from speeds of 165 to 170 miles an hour, depending on the racetrack.
Select the patients for the surgery based on the amount of leg length discrepancy. So if a patient only had about 1.5 centimeters or 2 centimeters leg length discrepancy, it's probably better for them to wear a shoe lift because that's not a huge burden on them. But when you're talking about 4 centimeters of leg length difference, that's a lot to just leave.
He couldn't play sports, he couldn't run. He would try and help me at our shop, and walking on gravel he would really have troubles and stuff, and he'd have to be careful. Me slipping on a rock was no big deal, but him slipping on a rock with his lift was a real problem. And so we knew that something was going to have to be done, and so then we went and started looking at solutions, and then met Dr. Coleus, and the rest is history.
This is the ball of the hip, and this is called the trochanter. And the nail, we actually make, first off, we make a path for the nail inside the bone. We make a canal for it. There is a hollow canal in the bone normally, but we enlarge the canal to put the device down. And then we actually have to physically divide the bone with drill bits and a little bone chisel called an osteotome. We divide the bone very carefully with the least trauma possible because we want all those bone cells and biology to stay there to make bone. And then the device gets inserted down, and then we have to put 2 locking bolts at the top and 2 at the bottom. And then over time, it actually, when we apply the remote control, it lengthens out in a controlled manner. There's an internal gear and a magnet that has an interaction with that remote control to allow lengthening.
Before I had met Dr. Coleus, I had thought that this was going to be, potentially something that I would have to live with for the rest of my life. This whole process has definitely been a team effort, and it's been awesome. And Dr. Coleus has just been amazing to work with and super helpful, and so is my physiotherapist, Tara Gemmer. She's just been amazing in helping me all the way along through this. And my personal trainer, Lori, at the Sports Science Institute, and all the nurses and everyone at the hospital was just super helpful, and they were great to work with, very kind people, and they did an amazing job.
We're extremely thankful, that Royce has the opportunity now to be fully healthy and be able to do normal activities. He was limited in so many things that he could do, and so now that he has job openings that he never had before, he would probably have to work a desk job, which is something he did not enjoy. Being at a computer, he wanted to be working with his hands and doing things like that. So we're excited to the doors that this does open for Royce.
Now that Royce's legs are the same length, he can walk around without crutches, and he's training to resume his racing career next year. Royce, a 5-time Canadian champion, will have the nail removed later this year.